I just introduced this topic first. I'm using a barbed thread for lifting the subcutaneous tissue. It was used for face, but now I'm using it for the tip of the nose, the cheeks, the breast, the vagina. And I'll show you one clip over here for the raising of the tip. Surukara? What I'm using is a thread which will go into the tip of the nose. He had a very acute nasolabial angle. So he was having a problem of breathing because the nasal valve was compressed or compromised. The thread is in the cannula. So when I introduce it, the thread gets deposited into the tissue. You have already seen the pre-op. I'll put the full video a little later. I'm just pointing out the tip of the nose correction. If you put from the tip to the dorsum, the lift gets affected on the tip, whereas if you put it onto the nasolabial angle, the nasolabial angle becomes obtuse.
The thread is already inside. Inside. So whenever I go inside, it gets deposited.
Achha. Wherever you are going, it gets deposited.
So I have deposited it.
Now I'll show you the pre-op and post-op. You can see this was the pre-op, this is the post-op. The tip is raised, and it takes about 10 minutes. Last video, Lava. Last video. This is a case of sound counter. This is a case of a facial, schwannoma case, post-op, after 3 years. He didn't want a proper surgery. So we had one-sided facial nerve palsy. What I did was take care of the facial palsy part by making a dimple first, so as to take out the monotony of the face. Everything is done the local. I'm making a incision with a bipolar cautery over here, inside the nose. I'm inside the cheek. Amrapali, this was not working at that time.
Yes.
And I bring out the suture outside the cheek. And at the same port, I put back the suture, but the trajectory of the thread is different. That's why it gets puckered in, as you can see over here. The depth of the dimple can be increased by taking more sutures. There's a dimple made, and now I'm marking the vectors for the thread. One at the nasolabial fold, second at the angle of the mouth, and third below the angle of the mouth. This is one of the methods. There are 4 or 5 threads available in the market. So I'm using one. This is a needle of introduction, which you snake in through the subcutaneous tissue and come out just near the nasolabial angle or nasolabial fold. In between, if you have any questions, you can stop me and ask, because the time is only 8 minutes and the video is of 7.5 minutes.
What is the thread material?
Proline.
And number?
Now 60. But nowadays we have other thread also made of PCLA with hyaluronic acid. So that hyaluronic acid gives rise to plumping and smoothing of the face.
Cost of the
Who's asking? Cost, this one which I am showing you is 15,000 for 2. Now there is a set of 10 for 50. 50. That's the only cost which you incur. Rest of the thing is, there is no local, there is no hospitalization, there is no dressing also afterwards. And believe me, this can be done even in a conference setting, in a hospital, on a kitchen table also.
This can be done under local anesthesia. This can be done under local anesthesia.
It is under local. It is under local, little bit of local. Yeah. But preferably you put a EMLA cream on the face, so that is numbs the skin. And here I am showing you, I am lifting up the thread. You can see the cheek being lifted up. This can come to me, I'll tell you. Result charge 2.5 years. In Indian patients 2.5 years, and European patients where they are made 3 years. Because come again?
If you use something different, like cock thread or something.
Cock thread is a little different. This one dissolves after 6 months or 7 months. But the fibrosis remains. Huh?
The one we use for pastry.
Yeah.
If you use for this thing.
Same thing is being used. This is just one of the threads which I am showing you. One technique. The other one which I showed you was the latest threads. So while tying the knot, you again judge the pull. If you pull hard, it will break. So it's a trial and error method in initial stages. Once you get the hang of it, then you can. And the essential part is that you don't use the elbow. You just use the wrist. Otherwise, you'll come out from the other side. And while tying the knot, as I said, you again judge the pull. In this method, 2 incisions were taken on the temporal side. Why temporal side? Because that doesn't get bald, whether it's a female or a male. Yeah. But nowadays we don't have to take this incisions. We can directly deposit the thread.
To avoid more needle. To avoid more eating those needle.
Correct.
Any advantage why you have taken a dimple, created dimple?
Dimple I offered to the patient just to break the monotony of the face. And that was not what he asked for. He just asked for the liftment. This is just one part of it which I just offered. And even in dimple also, I have shown you only one method. There are 4 or 5 methods available. This I am just putting a benzoin seal. This is not required, but I wanted to make this patient aware that something has been done. Because the post-op instructions are not to yawn and not to have any dental treatment done. Which normally such patients will not do it, but you still have people in Bombay getting this done. It's finished. And this I am talking of is 1 मिनिट फक्त आहे लावा आधी 3 मिनिटं तुम्ही दिले आता 1 मिनिट द्यायला काय हरकत आहे हां दिस आय एम पुटिंग ओनली स्टेरिस्ट्रिप this lets the skin breathe, yeah? And on top of that I am reinforcing it with micropore just to keep this in. And what happened was, making this go up enabled the patient to close the eyelids. Of course, for the upper eyelid I use the gold implant a little later, but that I am not showing over here. But you can see these 2 angle of the mouth are in the same position, and this has gone up. Okay, you can close it. Any other questions? I'll be happy to answer.
I would request Dr. Gaurav Agrawal sir to hand over the certificate to Dr. Mohan Jagade sir.